I'm in the maternity ward at Bow District Hospital. This is a visit in the southern part of Sierra Leone. We've had a tremendous scale up and jump in the figures of people who are able to access the healthcare facilities, and DFID working through a number of partners, and in particular local doctors, nurses, midwives, and also the health department have been able to make this transformational change, and it's making a real difference, as you can see behind me, to the lives of the women and indeed the very young children here in the Bow District. And this is really important in increasing the opportunities not only to save lives for the under fives and the pregnant mothers from the scourge of malaria, but also to make sure that they have good, safe childbirth and also good advice on reproductive health. And it's an opportunity to get a full package of health measures. This is to do with reproductive health, to do with family planning, to do with how they keep themselves and their babies healthy, to have malaria prevention, so they get the idea of how to really use nets. And nets are distributed at the same time, so it's a real opportunity to bear down on the biggest killer in Africa. Well, we've had an extraordinary experience today with the student partnership worldwide, which is now known as Restless Development, which is a very good name to describe how there is an urgency and a young energy involving the young people, both volunteers occasionally from abroad, but primarily from within Sierra Leone, who are there to try and make sure that children and teenagers and young adults understand the enormous importance of how they remain healthy, how they make their choices about when they have sexual relations, and the opportunities to use contraception and other methods which are going to keep them healthy.
If me and you be faithful and other tomorrow who are married, they will not be infected with this HIV.
We've all seen something which is really powerful, and it's a communication opportunity for all the people here who will now become ambassadors for the message. And so there's a tremendous opportunity for us to build on this good practice. We have been to the family support unit. This is a fairly small premises which is attached to the main police station in Bow. Part of the problem for many women here is that they do suffer sexual and physical violence, and they are finding it very difficult to have the confidence to take their troubles and the serious physical damage, let alone the emotional and psychological damage, as they seek refuge from what has often been a very, very bad experience. So DFID has been very pleased to be a partner in helping the Family Support Unit, where we had a good presentation jointly from the women who are running it, the men who are helping, and also the police officers who are partners in this. And this was a tremendous initiative. It does need to develop more, and it is giving people an opportunity not only to mediate, but also to hold some people to account where they really have perpetrated some of the most awful crimes. This is an initiative that's worth pursuing, and one which could give hope to many women in Sierra Leone who have not had hope before.